Okay, now let's go to the basic ECG reading and of course the most common dysrhythmias or cardiac arrhythmias. Okay, so ECG reading or your EKG reading or electrocardiography. So what is happening in ECG reading is we use this to read electrical activity from the heart. Yun yung diniscuss ko earlier, which talks about the electrical conduction system of the heart. So, dito na tayo sa mismong ECG reading and the common dysrhythmias or arrhythmias. When you say dysrhythmias or arrhythmias, this basically means abnormal rhythm. Okay, abnormal rhythm. So, before we proceed to the different components of an ECG, we first have to recall yung depolarization versus repolarization. Pag sinabi nating depolarization, unequal yung charge sa loob at sa labas ng cell. Therefore, nagkakos siya ng contraction sa heart muscle. Pag sinabi naman nating repolarization, bumabalik siya sa equal ulit yung charges on both inside and outside of the cell, which causes relaxation of the heart muscle. So, depolarization, contract. Repolarization, relax. As in re and re. Repolarization, relax. So, these are the different components of an ECG. We have the P wave, the QRS complex, and the T wave. So, si P wave, what does this represent? This represents atrial depolarization. Okay, ibig sabihin, this is when the atrium contracts. Okay, nagko-contract si atrium during the P wave. And then during the QRS complex, this represents two things. Number one is atrial repolarization. Ibig sabihin, napopolarize ulit si atria at nagre-relax. And of course, ventricular depolarization. So dito, nagko-contract naman si ventricle. And then of course, your T wave or your ST segment, this represents ventricular repolarization or basically the relaxation of the ventricle. So what happens here is, okay, contract, that's your P wave. And then, pagpunta ng, okay, so in here, for example, ito yung heart natin. So si atria sa taas, si ventricle sa baba. Okay? So pag P wave, okay, during P wave, contract sa taas, relax sa baba. During QRS, okay, relax naman si atria, contract naman si ventricle. And then during T wave, naka-relax na silang dalawa. So yun lang yun, okay? Because you have to remember every time a muscle contracts, it has to relax after. So si atria ang pinaka nauunang nagko-contract. Okay, so contract siya. Pag nag-contract siya, naka-relax mo na si ventricle. Bakit? Nagko-contract ang atria natin to allow, okay, the blood from the atria to empty into the ventricle. Okay, and then, after niya mag-contract, kailangan niyang mag-relax. So, kapag nakapag-relax na siya, ibig sabihin yan, puno na si ventricle. So, the ventricle now has to pump blood. So, pag nag-relax na si atria, the ventricle has to contract. And then again, after a muscle contracts, it has to relax. So, after QRS complex, doon na tayo kay ST segment or the T wave, doon na nagre-relax si ventricle. So those are the different components of your ECG. P wave, QRST, and T wave or your ST segment. So P for atrial depolarization or atrial contraction, QRS for atrial repolarization or relaxation, and ventricular depolarization or contraction, and then T wave or ventricular repolarization. So sa isang ECG kasi, if you can see, meron siya mga box, okay, boxes, big boxes. And inside those big boxes, we have, okay, sorry, mali yung pag-drawing. We have, okay, smaller boxes. Okay. So, in every big box, there are 20 boxes. So, 4 by 5 boxes. And every box, every small box is equivalent to 0.04 seconds. So, ang isang box, so 0.04 times 1, 2, 3, 4, 5. Okay, so ibig sabihin, one big box is equal to 0.20 seconds. Now, in reading, I should say, an ECG, there are 3 things that we have to check. You have your 3 R's, okay? You have the rate, the rhythm, and the regularity. Okay, pag sinabi nating rate, this basically refers to the number. Okay, the frequency. Ilang beses nangyayari itong buong ito, your PQRST. How often does it happen? Gaano kadalas siya nangyayari? Number, frequency. Okay, ilang beses nangyayari, that's the rate. And the next is the rhythm. Okay, eto na si PQRST. T, when you say rhythm, meron bang P wave? Meron bang QRS wave? A complex? Meron bang T wave? Yun si rhythm. Okay? Basta, pag sinabi natin rhythm, this refers to the arrangement or the completeness of the components of your ECG. So, P, QRS, T, meron ba silang lahat? At in order ba sila? Visible ba silang lahat? Normal ba sila? That's your rhythm. And when you say regularity, okay, this refers to the similarity every time na nangyayari itong buong component na to, every time nangyayari siya, pare-pareho ba? Similar ba siya sa rate at sa rhythm? Okay, ibig sabihin, regularity refers to the similarity in rate and rhythm per component. Okay, or per set. Okay, per beat. Okay, pare-pareho ba siya? So, ibig sabihin, pag regularity, for example, in here, okay, for example, okay, ganyan. Okay, ganyan ba, yung rate niya, yung bilang ba niya, okay, at yung rhythm niya is pare-pareho ba? That is regularity. So, those are the things that we have to read when in terms of ECG. So, the rate, the rhythm, and the regularity. So, yan yung basic components. You have the P wave, QRS complex, and the T wave or the ST segment. Now, let's talk about the common dysrhythmias or arrhythmias or irregular heart rhythm. So, first, we have sinus bradycardia and sinus tachycardia. Okay, bakit pareho silang sinus? Ano bang ibig sabihin ng sinus? When we say sinus rhythm, pag sinabi kasi nating sinus rhythm, this basically means normal rhythm. Okay? Normal ang rhythm. So, in here, you have sinus brady and sinus tachy. Ibig sabihin yan, yung rhythm niya, normal. Ibig sabihin, kompleto si PQRST. But, okay, the problem here is sa rate. Okay, rate ang problema. Yung number of occurrences, ilang beses silang nangyayari. When you say sinus bradycardia, ano bang normal heart rate natin? 60 to 100. When you say sinus bradycardia, this refers to a beat less than 60 beats per minute. Okay, pag sinabi naman natin sinus tachycardia, this is greater than 100 beats per minute. Okay, now, let's go to the atrial problems. You have atrial flutter. This is FLUTTER. Atrial flutter versus atrial fibrillation. Okay, atrial flutter versus atrial fibrillation. So, in an atrial flutter, okay, there is, okay, masyadong excited ang ating atrium. So, contraction ng contract. Normally, isang atrial contraction, isang ventricular contraction. Tama? Every time matapos mag-contract si atrium, si ventricle naman na mag-contract. Ganun dapat. But in atrial flutter, okay, excessive ang contraction ni atria. So, what happens here, there is 2 to 3 P waves every 1 QRS complex. So, anong itsura nito? Okay? Para siyang, okay, 3, and then isang QRS, and then isang QRS. Okay? Ito yung tinatawag nilang sawtooth. Okay? Para siyang lagari. Okay, because there are 2 to 3 P waves every 1 QRS complex. This can reach up to 300 P waves every 150 na QRS. Okay, it could reach up to that. Okay, yun ang ating atrial flutter or yung sawtooth pattern. Okay, maraming P wave and every isang QRS complex. Next, you have atrial fibrillation. Pag sinabi nating atrial fibrillation, there are no P waves. But, normal si QRS and si T. Okay, normal si QRS and si T wave, pero walang P wave. So, paano itsura niyan? You have QRS, T, normal. And then P wave, S. And then, okay, so wala siyang P wave, okay? But there is normal QRS and T waves. Now, ito yung pinakadelikado sa kanila lahat. Your atrial flutter and your atrial fibrillation puts a person at risk for developing stroke. Paano? Because in atrial flutter and atrial fibrillation, likely sila na mag-develop ng blood clots because of the abnormal heart rhythm or the abnormal rhythm of the atria. Pwedeng mag-develop ng blood clot ang isang tao, and that blood clot can travel into the patient's blood vessels that are supplying the brain. Okay? At pwedeng mag-clot yan or magbara sa brain ng tao, which can cause stroke. Okay? Bakit siya magkakause ng stroke? Kasi nai-impede, nade-disrupt or nababarahan yung flow ng dugo, which basically impedes the flow of oxygen into the tissues of the brain, which causes death of those tissues. And that, everyone, is stroke. Okay, now let's talk about VTach and VFib. In your ventricular tachycardia, okay? In your ventricular tachycardia, puro QRS. Okay? Halos puro QRS lang ang nakikita natin when you look at ventricular tachycardia. QRS, PQRS, PQRS, PQRS. Okay, QRS lang, QRS ang ating patient. So, how does ventricular tachycardia look like? Okay, pag sinabi nating ventricular tachycardia, paano ba siya drawing? Okay, so we have, okay, puro siya QRS. QRST, QRST. Okay, QRST, QRST. Yan na lang itsura ng ventricular tachycardia. In your ventricular tachycardia, this has a high risk of developing into ventricular fibrillation, which is the most dangerous as far as I know. Pinaka-dangerous siya na cardiac arrhythmia. In your ventricular fibrillation, magulo. Okay, wala ka ng identifiable na P, QRS, or T. Okay, bahala na siya sa buhay niya. Okay, bahala ka dyan. That is your ventricular fibrillation. Okay, now, and of course, hindi natin pwedeng kalimutan si asystole or basically flatline. Now, which of the following are shockable? Ibig sabihin, pwede natin gamitan ng defibrillation. Ano yung pwede natin gamitan ng defibrillation or yung sinashock? Okay, which are your shockable rhythms? Shockable rhythms are these two. Your VTach and VFib, no pulse. Pag walang pulso ang pasyente and they are on VTach and VFib, they are shockable. Okay? Pwede silang i-defibrillate. And everyone, contrary to common misconceptions, asystole is not shockable. Hindi natin dine-defibrillate ang asystole. Okay? Ang sinashock is VTach or VTach and VFib, no pulse. Okay? So that's it for basic ECG reading and most common dysrhythmias.